Hey guys, welcome back to my channel. So most of you were asking me about pharmacology third 6th semester question and answers as per RGUHS question bank. So today I am going to solve the pharmacology 3 as per RGUHS question bank. In unit 1, the drugs acting on respiratory system, there are no 10 marks. So I'll start from the 5 marks, that is short essay. So question number 1, what is bronchial asthma? Classified drug used in the treatment. So the bronchial asthma is a condition in which a person's airways became inflamed, narrow and swell, which produces extra mucus and which makes it difficult to breathe. So asthma is a common set of chronic disease in children and in adults as it increasing in prevalence and severity. So it is an inflammatory condition. What are the characteristics of asthma? The asthmatic patient's intermittent attack on wheezing, shortness of breath, difficulty, especially in breathing out and sometimes in cough. So it is also characterized by inflammation of airways, bronchial hyperreactivity, reversible airway obstruction and chest tightness. So the classification of bronchial asthma which are used in the treatment: number 1, bronchodilators, in that A, beta 2 sympatomimetic, example salbutamol, terbutaline, and B, methyl xanthine derivatives, thiophyllene, aminothiophylline and caffeine, and C, anticholinergic, atropine, epiratopium bromide and tiotropium. So number 2, leukotriene antagonist, in that montelukast and zafiralukast are the examples. Number 3, mast cell stabilizers, example sodium glucomate and ketotifen. Number 4, corticosteroids, in that systemic corticosteroids and inhalation corticosteroids, where the systemic corticosteroid examples are hydrocortisone and prednisone, where inhalation corticosteroids are beclomethasone and dipropionate. Number 5, anti-immunoglobulin antibody, example omabezilob. And the types of asthma are extrinsic asthma, in that A, it starts in early stage, which is in the episodic form where the patient has the history of allergy. And number 2, that is intrinsic asthma, where it starts in the middle age. It is an chronic form and it is not genetic. So initiation of asthma, where the inflammation starts with the mast cell which is present in the lungs, and the inflammation produces the mediators are intracellular granules, histamine protease enzyme increases, PG and LTs, hormones, that is interleukin, TNF and PAF. So question number 2, that is mention xanthine derivatives and write their mechanism of anti-asthmatic action. So there are 3 pharmacologically active naturally occurring methyl xanthase, thiophil, thiobromine and caffeine. So thiophyllene, which is also used as thiophyl ethanyl diamine, which is known as aminophylline, is the main therapeutic drug of this class. So the thiophyllene has more bronchodilator action, where although it is more likely to cause side effects than the beta adrenoreceptor agonist and has a less favorable risk benefit ratio. So the pharmacological action in that asthmatic are: number 1, CNS, central nervous system. It stimulates the CNS. They causes the nervousness and interfere with the sleep and has a stimulant action on respiration. So this may be useful in patients with COPD. And number 2, CVS, that is cardiovascular system. So it stimulates the heart, having positive chronotropic and inotropic action, which relaxing the vascular smooth muscles. So they causes generalized vasodilators and but have restrict the cerebral BV, means blood vessels, So number third, that is kidney, weak diuretics, although this effect is non-therapeutic, useful. Number fourth, mast cell, which decreases the mediators. Number fifth, metabolism, which increases the basal metabolism. Number six, stomach, increase the secretion like pepsin and acid, which causes ulcer. Number 7, skeletal muscle contraction. It increased the calcium level in the sarcoplasmic reticulum. And the mechanism of action of xanthine derivatives are: number 1, methyl xanthal, where the bronchodilation of non-specific inhibition of phosphodiesterase isoenzyme, where number 2, the inhibition of PDE third and fourth prevent the degradation of CAMP in the airways smooth muscles, which leading the accumulation of CAMP and causes the smooth muscles relaxation of bronchial. Number 3, PDE4 inhibition, which decreases and releases of cytokinin and chemokinins. Number 4, they act as an antagonist to the adenosine receptor and causes the bronchodilation. And number 5, note it is an important: adenosine antagonist effect is not uniform for all the methyl xanthines. For the example, N-protyline. So it is a potent bronchodilator but not an adenosine antagonist. So this is the effect for considered as a secondary effect, where the normal BSM plus PDE3 and 4, where degradation occurs into the CAMP and bronchial constriction will begin. Methyl xanthase were added, so negatively PDE third and fourth, which increased the CAMP and the bronchodilation occurs. So question number 3, explain mechanism of action, adverse effect and therapeutic effect, uses of selective beta agonist, that is salbutamol. So the mechanism of beta agonist salbutamol, the beta 2 agonists are a coupled of GS protein, so the activation of adenylyl cyclase enzyme. This catalyzes the production of CAMP, which equals to the causes smooth muscles relaxation. In the lungs, the CAMP causes decreased intracellular calcium level and causes the smooth muscles relaxation. So the beta 2 agonist is equal to increase in the conductance of calcium, which is dependent for potassium channels in airways smooth muscles, where fifth, this leads to hyperpolarization of smooth muscles, which causes the relaxation. And in sixth, the stimulation of beta 2 receptor is equal to decrease in the function of inflammatory cells like mast cells, basophils, eosinophils, neutrophils and lymphocytes. So number 7, beta 2 receptor activation in the inflammatory mediator cells are equal to increase in the CAMP and deposition. This decreases the release of inflammatory mediators and cytokinins, where ultimately causes to the smooth muscles relaxation. Example, salbutamol, terbutaline and salmeterol. So the adverse effect for salbutamol are tachycardia, cardiac dystonia, hypertension, skeletal muscle tremor, peripheral vasodilators and hypokalemia, which is occurs due to high dose. Then the contraindications: coronary artery disease, myocardial infarction and cerebrovascular stroke. The therapeutic uses for salbutamol are: number 1, short acting drugs, where the salbutamol drugs are which is used to treat the wheeze in the patients with reversible obstructive airway disease. And number 2, long acting drugs, where the salbutamol are the drugs in which they are used to treat or prevent the bronchospasm. And the pharmacokinetic for salbutamol are: for the 3 hours after the oral inhalation, 80 to 100% of the dose is excreted through the kidney, while the first 10% may be eliminated in the feces. for salbutamol. And question number 4, that is classify anti-tissue with example, write their general mode of action and the uses. So the anti-tissue agents are the mainly used in the treatment of dry cough, where it gives relief from the dry cough, mainly act as a suppressed the cough center which present centrally and peripherally. So it is also called as cough suppressant. And the classification for anti-tissue drugs are centrally acting drug, where opioids in that example morphine, codeine, hydrocodone and ethyl morphetone. Number 2, non-opioid example dextromethorphan and nesecapen. Number 3, antihistamine example chlorcyclazine, diphenhydramine and promethazine. So number 2, that is peripherally acting drugs, in that phenterodiazine are the example. And number 3, drugs have both central and peripheral, in that benzoate non-nanotic drug. So pharmacological action for centrally acting drugs, the opioid are, these are the opium alkaloids, in which they are naturally occurring action of codeine and have a similar to morphine. So the mechanism of action or the mode of action are mainly these act on the opioid receptor, magnesium, potassium, sodium, which are used and present in the central nervous system and the peripheral nervous system, and these drugs are work to receptor and relief from the cough, where they by increased in the threshold of the cough. And the pharmacological action analgesia, severe pain, suppressing and increased the effect to bear the pain, sedation, eunophia, respiration, depress the respiratory tract on the center of respiration, cough center, codeine is directly suppress the cough center, CTZ, that is chemotrigger receptor, where nausea and vomiting, eye, constriction of pupil, CVS at higher dose, which depresses or decreases the blood pressure, bradycardic and cerebral vasodilator, and gastrointestinal tract, where decreases the peristaltic movement. And question and 9, that is smooth muscles, which leads to the urinary retention by contraction of urinary bladder, where muscles, it also produces the bronchial constriction. And number 10, hormones, so secretion of GH, prolactin are increased, where the LV's hormones decreases, and antidiuretic hormone, where increases causes decreased in the urine secretion. And the uses, it is used to treat the diarrhea, which is used in the treatment of asthma, and it is used in cough suppressant. So question number 5, what are mucolytics? Give example, write the mechanism of action of bromohexane. And the mucolytic agents are the drugs which leads to aids the clearance of mucus from the upper and lower airways. So the mucus is made in your lungs. Mucolytics are the medicines that makes the mucus less thick and sticky and easier to cough up. So these drugs are mainly used for the people who have a long-term chronic cough. Example, bromohexane and ambroxol and carbocystine. So these are the examples for cough. Mechanism of action of bromohexane. So depolarization of mucoproteins and mycopolysaccharides of expectorants that induces the liquefaction of the cough. They also stimulate the production of surfactants in the alveolar cells. So they normalize the secretion of bronchial glands and improves the rheological properties of sputum or thin the sputum, which reduces the viscosity of the sputum, and it is also done by liberating lysozymes enzymes. So where the pharmacokinetics, it is rapidly absorbed from the gastrointestinal tract and undergoes extensive first pass metabolism and in the liver it is by the bioavailability oral is stated to be only about 20%, and it is widely distributed to the body tissue and is highly bound to plasma, where the adverse effects are nausea, rash, vomiting, diarrhea, and pain in the upper part of the stomach. So the contraindication, it is contraindicated for use in patients with known hypersensitivity reaction of bromohexine. So the uses of bromohexine are: it is used to treat the chest congestion and the cough. It belongs to the group of medication called mucolytics, which work by breaking the mucus down so that it is easier to cough out. And question number 6, what are respiratory stimulants? Explain the pharmacology of any one. So the respiratory stimulation is a characteristics of aspirin intoxication, where it occurs both directly by the stimulation of respiratory center and indirectly through the increased carbon dioxide production. So these analeptic drugs are there for central nervous system, which stimulates, and as well as the respiratory stimulants. The rise in the carbon dioxide stimulates the respiratory center to increase the rate of depth and respiration to remove the carbon dioxide, where the example doaxaperam and petricamide, where the pharmacology of doxaperam are the mechanism of action. Doxaperam stimulates the respiration by an action on peripheral cardioid chemoreceptor. As the dosage is increased, the central respiratory centers in the medulla are stimulated with the progressive stimulation. So the other parts of the brain and the spinal cord, which may elevate the blood pressure by increasing the cardiac output due to the stimulation of corticoid and erotic body chemoreceptors. So the pharmacological action in that CNS, which stimulates the respiratory tidal volume, which increases and means move amount of air is removed out, which increased the rate of respiration due to the stimulation. At higher doses, its stimulation of CNS causes convulsion, and CVS increases the volume, increases blood pressure, which react stroke. So contraindication, asthma, epileptic patient. Adverse effect, so tachycardia, increased blood pressure, hypertension, tremors, and vomiting. And the uses, it is used in COPD along with the other drug, and it is not used for COPD. So in acute respiratory insufficiently, the drug used. And question number 7, define respiratory stimulant with example. Write the mechanism of action and the therapeutic uses. So you have to refer question number 6. Here we have completed the 5 marks of unit 1 pharmacology third 6th semester. So tomorrow I am going to give 2 marks. So please do like and share, subscribe to my channel. Thank you very much.